Good afternoon. I'd like to welcome you on behalf of Sheriff Mitzi Johanknick, who could not be here today, Executive Constantine, and Team King County. The opioid epidemic, anywhere as I travel in the nation, is extremely problematic. Doesn't matter whether you're in suburban areas of the West Coast or in your small towns in rural New England. There are very few communities, very few families that have not been touched or significantly impacted by prescription opioid addiction. People moving on to heroin, and the impacts it has on our families and communities. It's stunning to see across the nation. It's stunning to see when it happens in your family. And so we also see now the onset of fentanyl coming into the picture, and it impacts us even more. It's even more challenging for us as good stewards and community leaders to figure out strategies to try to reduce the incidence of it and to move it on. But from a law enforcement and I just think a regular community perspective, again, you have people who have access to prescription opioids who become addicted. They sometimes go on to heroin or other types of drugs. We see the impacts in that they commit crimes to support those habits and addictions. They move on to heroin, which is a lesser, or less cost-effective way of supporting that addiction. So they're committing crimes, impacting the community. Law enforcement has to respond and investigate that. But the big crush for us has been increases in overdoses, where we are coming into contact with people who are at death's doorsteps. And the Sheriff Johanknick earlier this year mandated the issuance and carrying of naloxone, a drug to save people who are on overdoses with certain type of opioids. And what used to be weekly saves, moving more towards daily saves. And I think all the other law enforcement agencies in the regions are having the same experience. So we as a group have been working with Senator Cantwell and very much appreciate her efforts in this area. And as a group, we want to be able to talk with you about some of the efforts that she's been leading and talking and explaining to you some of the support that we're going to be getting and some of the impacts that we're hoping to be able to affect.
Good afternoon. I'm Jeff Duchin. I'm the health officer for Public Health SCAL in King County, and I'd like to acknowledge my gratitude to Senator Cantwell for her leadership on the Opioid Crisis Response Act, which takes a number of positive steps to support our public health response to the devastating impact that this opioid epidemic continues to have on people here in King County and across the country. Many of the provisions in the bill align with the recommendations from the King County Heroin and Prescription Opioid Task Force, which I co-chair. We know that expanding access to medication-assisted treatment is the most important strategy to keep people alive. And medications such as buprenorphine and methadone can reduce deaths from overdose by 50%. And to be successful, we really need to greatly increase the number of healthcare providers and number of facilities that are offering this treatment. And we must ensure that everyone has access to substance use disorder and behavioral health treatment that they need. The Opioid Crisis Response Act makes permanent the ability for physicians, assistants, and nurse practitioners to prescribe medication-assisted treatment and for doctors to treat up to 275 patients with medication-assisted treatment. And this authorization would have expired in 2021 otherwise. The Act also reauthorizes funds for the state targeted response grants that have provided $23 million to Washington State for prevention and treatment. And in King County, we've used these funds to expand access to methadone treatment and for our hub and spoke medication-assisted treatment models in collaboration with our healthcare facilities. At the same time, we need to be clear that the human and economic toll of the opioid epidemic is staggering. The economic costs are in the billions of dollars each year here in Washington State alone, and over $500 billion annually nationally. Last year, 258 King County residents died of an opioid overdose, approximately one death every 36 hours. In the US, approximately 49,000 people died of an opioid overdose, or 136 people every day. The number of opioid-involved deaths nationally last year alone was comparable to the number of deaths from HIV/AIDS at the peak of that epidemic. And the federal government rightly provides tens of billions of dollars every year in critically necessary ongoing funding to combat HIV in the United States. And that's something we can all be very proud of, and Senator Cantwell is a strong supporter of that. We need a similar level of sustained investment in our health and medical response to the opioid epidemic for prevention, monitoring, and social services and treatment. I'm hopeful that the health and medical programs highlighted in the Opioid Crisis Response Act and other needed measures will receive the levels of long-term funding that they require for us to successfully respond to this enormous and unprecedented public health challenge. I'd like to now introduce Seattle Assistant Police Chief Deanna Millett.
Thank you. As was noted earlier, there is a significant intersection between public safety and public health. Our officers are on the front line of this opioid crisis, and it's one of the most urgent public health and public safety issues facing Seattle, the Puget Sound region, and the nation. SPD alone responds to more than 100 overdose-related calls every month, including opioids and methamphetamine. Since March 2016, our frontline officers have been equipped with naloxone through a generous donation from Penny Legate, the Mara Project, and PARI, the Police-Assisted Addiction Recovery Initiative. The SPD officers have since reversed more than 24 potentially deadly overdoses. That's nearly one life every month for the last 2 years. Senator Cantwell's comprehensive bill will allow law enforcement to customize their responses to their communities. The bill provides resources, enhanced tools and training for law enforcement, increased collaboration, and a more comprehensive approach to the opioid crisis. The components of this bill will increase both safety for law enforcement and for the community we serve. Thank you, Senator. I'll now introduce Pierce County Sheriff Paul Pastor.
I think there's something important worth taking note of here, and it's this. This is the way government is supposed to work. Federal government, local government, state government working together to solve problems. The problem is large, the problem is difficult. Let me put a personal spin on it. I was out on New Year's Eve, this last New Year's Eve. The first call I responded to was a call of someone unconscious in a car. The person unconscious in a car had been there for 6 hours. When we got there, there was a 20-year-old young man who died of synthetic opioid overdose. I remember pulling him out of the car. I will tell you that wasn't very pleasant, helping the medical examiner get him out of the car. Here's something that was even harder. I knew that one of our people were going to have to go to his parents and tell him the heartbreak of losing that young man. That's what we're talking about. We're talking about damage to communities, damage to families, difficulty for law enforcement. And here's what we've done too much of in America. We've said, just let the cops handle it. Let them take care of it. Addiction, mental health, homelessness, let the cops handle it. This is a step in linking public health, law enforcement, and prevention. Those are the three legs of the stool for drug issues. We learned that before when we dealt with a methademic here in Washington State. Senator Cantwell is not just doing this in the other Washington. She was here for our opioid epidemic meeting. Help me.
Summit,
thank you.
Pierce County Summit.
And got firsthand information about how we're handling it, the problem we're presenting. Just let the cops handle it doesn't do it. But enforcement is an important part, treatment is an important part, prevention is an important part. I'm glad because we're going to be able to take this and make a difference. And now you will hear from my brother sheriff, Ty Trineri.
Thank you, Paul. I almost feel like I don't need to say anything because you did such a good job. Good afternoon, everyone. I think the important theme here that I just kind of want to revisit is the idea of collaboration, right? Sheriff Pasteur very eloquently talked about law enforcement's role, and I would add that this notion that we're going to arrest our way out of the problem, that a pair of handcuffs and a trip to jail will somehow solve this epidemic is nonsense. And we need to stop having that conversation. We talk about important legislation like this from Congress. This is the stuff we've been looking for. Law enforcement has been pleading for help, and I can't thank Senator Cantwell enough and her colleagues in this bipartisan effort. There's some really specific things that I think it's important that we give you. For example, in my county unfortunately has the distinction of being one of the top 3 most drug-addicted counties in the state of Washington. We have 10% of the state's population, and unfortunately we have 18% of the state's opioid deaths. That is not a distinction that anybody wants to talk about. And one of the other things that I think we need to talk about is who are these people? In Sheriff Pasteur's discussion, he talked about that young man that he had to go out and basically help the ME with. These are people's sons and daughters, their husbands, their aunts, their uncles, their even grandparents. And we need to talk about their life. This idea that somehow their death solves the problem is ridiculous and isn't what any one of us in law enforcement got into the business for. So let me talk for just a minute about the STOP grant, because I think it's important to find what some of the things are going to be. As I mentioned, Congress has heard the pleas from us, and I'm encouraged that the recent passage of the Senate's Opioid Crisis Response Act, or STOP, will help stop the flow of opioids, especially fentanyl, into our communities. You heard a little bit about fentanyl. Fentanyl scares us to death because it is wickedly potent and can cause immediate death or harm to folks. Earlier this year, I had a deputy that was exposed to fentanyl. We had to use Narcan to revive him and transport him to the hospital. Just yesterday, I had a couple of patrol units making a drug arrest on a known drug dealer, and we confiscated 60 fentanyl pills. That stuff's scary, and legislation like this is going to help us be safer. In 2017, there were at least 11 fentanyl-related deaths in my county. Preliminary data from the medical examiner in my county today shows that in the first 8 months of this year, we've more than doubled that amount, with at least 26 people dying from a fentanyl accidental overdose. We've also seen an increase in counterfeit Perk 30 pills on the street, which are laced with fentanyl. These were most likely produced by an illicit pill press, and at one point distributed using the most basic common method, which is the U.S. Postal Service. The Synthetics Trafficking and Overdose Prevention Act that we are here today to talk about is going to help us in several ways. One of the frightening aspects of fentanyl, as I've mentioned, is its danger and potency. The fact that it can be mailed through the Postal Service with no tracking. Funding in this legislation will help expand training for law enforcement and how we deal with fentanyl, and it will also give us greater access for naloxone training. Naloxone has been an amazing tool for law enforcement because, as we mentioned, the arrest and incarceration piece of this isn't working, and so one of our responsibilities is to be first on the scene and use naloxone. In my county, all law enforcement officers currently have naloxone, and last year we reversed 182 overdoses through its issuance. So to wrap up, on behalf of Snohomish County, I want to personally thank Senator Cantwell and her colleagues for all of her leadership and effort. This will give us great tools, and we appreciate all of her work. It's now my pleasure to introduce our Attorney General, Bob Ferguson.
Thank you so much, Sheriff. Thanks to everybody who's here from law enforcement, public health communities who are really on the front lines addressing this epidemic. I won't repeat any statistics that were already said about the epidemic. I'll just add one thing, and that is that if I'm speaking to a Rotary Club or a Kiwanis Club or just a group, some group around the state of Washington, I usually would touch on the opioid epidemic, the lawsuit we have, work that the senator is doing, work that law enforcement, public health are doing to deal with it. And this is virtually without exception. One of two things will happen. Someone will raise their hand and say, you know what, I have a family member who's impacted by this, or a colleague at work, or a friend who's impacted. I had one Rotary Club meeting, literally in Central Washington, where every single question was about opioids, every single one. Or if someone doesn't want to raise their hand, someone will walk up to me after the meeting's over, and they'll kind of pull me aside. I know exactly what they're going to say. Hey, Bob, right? My spouse, my child, my cousin, my friend is suffering from this. It is truly an epidemic, and that's why I so appreciate, going to your point, Sheriff, right, that bipartisan work of the way things should work. And one thing I've come to realize is that whether you're in a small city council or the state legislature or at the U.S. Congress, what you need to get something passed, which is always hard, right? It's always hard, is you need a champion for that issue. You need someone like this is their priority. They're going to reach out to the stakeholders. They're going to work in a bipartisan fashion. They're going to do what it takes to get it done. And that's exactly what Senator Cantwell has been doing. Just the one specific part of this legislation that I so appreciate is for those AGs and counties and cities who are filing lawsuits, for example, against distributors and entities related to the opioid epidemic, to hold them accountable, is what the bill that the Senator is proposing increases dramatically the penalties for those manufacturers when they know or have reason to know that there is suspicious activity going on with those who are acquiring those opioids. Greater accountability for those who don't play by the rules, and the consequences are the sheriff pulling the young man out of a car and his team having to go communicate that tragic loss to a parent. Those penalties need to be increased, and Senator Cantwell is leading the charge in making that happen. So I just want to say on behalf of everybody here how much we appreciate Senator Cantwell's determination. She's relentless on this issue, and it's my great honor on behalf of all of us here to introduce Senator Maria Cantwell.
Thank you.
Yeah, thank you, Senator.
Thank you, Attorney General, and thank you for being here. King County Under Sheriff Summers, thank you for hosting us and for your work. And Dr. Dusha, thank you for articulating why this issue is so important on a grand scale to be comprehensive. We've had so many meetings around the state of Washington, and I listened to what everybody said, from Port Angeles to Spokane, from here in Everett, all the way down to Longview, and that is why we're here today, to say that we are one step closer with the passage of this legislation in the United States Senate to getting this legislation enacted into law. Hopefully our House colleagues will take it up. They can make a few changes, but not too many, because we want this legislation passed, and we want this legislation passed as soon as possible. We're here because I listened to the law enforcement entities and to the Attorney General in looking at what we needed to do in the opioid crisis. So here in Puget Sound, we now have a solution that is one step closer to giving law enforcement the tools that they need to help us fight in this big challenge. As has been mentioned, it includes the STOP Act, which will help crack down on the shipments of fentanyl through the United States Postal Service. So thank you, Sheriff, for mentioning that. I listened a lot to what Snohomish County had to say about this issue, given that you were at the epicenter of the epidemic. This was a hard one. Obviously, there were some of our colleagues who didn't want to proceed on this. The fact that it's in the legislation is something we're thrilled about. It authorizes new funding grant programs to help train law enforcement, to give them the tools, and to be protected against the deadly events of fentanyl themselves. So thank you for mentioning that as well, and the impacts that it has on law enforcement that are here. It reauthorizes the drug courts, which is so important for giving us the tools that you need to deal with this, so it is comprehensive, as Dr. Dushan said. And it reauthorizes the high-intensity drug trafficking area, HIDA grants, that law enforcement needs so badly to help augment their challenge as they are on the front lines of the crisis. And it makes the ability for doctors to serve up to 275 patients through the medication assisted treatment program, as Dr. Dushan said, which is so important for helping them meet from the perspective of solutions that they can get to patients right away, a comprehensive approach. But as Attorney General said, we also are here to talk about a very important change that gives our local communities more tools to fight the illicit distribution of this drug. Congress passed the Controlled Substance Act in 1970, and it was to regulate drugs that are highly addictive, including prescription opioids. Opioids, because they do have important medical use, were classified as a Schedule II drug under the Controlled Substance Act. That is because they had a very, very, very high potential of abuse and prolonged use, and they could have severe psychological and physical dependence traits. So because they were so addictive, Congress said you have to have and follow a strict network of laws under the Controlled Substance Act to know exactly where opioids are being distributed and to who, and to keep track of that, and to make sure they didn't fall into the hands of a dark market. So Congress intended opioids to be tracked and to make sure there were strong reporting requirements. That was what the law said. But unfortunately, manufacturers didn't do that job, didn't do the tracking, didn't follow it. Despite these requirements, large quantities of opioids flooded into our communities because of excessive shipments from manufacturers. In one example, a physician in Everett, Washington wrote more than 10,000 prescriptions of opioids. This number of prescriptions was 26 times higher than the average prescriber in Everett. So, I think that sounds suspicious, but the drug manufacturer didn't report this suspicious activity, and DEA didn't have the information. In fact, the manufacturer not only failed to report the suspicious order, they insisted increased sales were related to this physician. Well, why did this continue to persist? I believe is because the fines currently in place for breaking the law, for not tracking this distribution, were so small, people didn't think that it was really a threat to them or their business. Current fines for failing to follow the federal law just aren't enough. They did not create a behavior and pattern that we needed. So as I traveled through the state and listened to our communities who are bringing charges against manufacturers, I knew that we needed to do something to strengthen these tools, and that is why there is a provision in this legislation to increase those civil penalties for opioid manufacturers who fail to follow the law by 10 times, from $10,000 to $100,000 per violation, and it doubles the criminal liability from $250,000 to $500,000 per violation. These violations increase the chances that opioid manufacturers will think twice about these severe penalties if they continue to thwart the law. Just to give you an example, in that one case in Everett, they could see potentially $920 million of fines because of their activity. I think $920 million in fine is something that any drug manufacturer would take seriously. We think this will help, and I so want to thank Bob Ferguson and the 39 other attorney generals throughout the United States who helped us craft this provision of the law. This was so important because as these men and women are on the front lines of fighting this, we also have to get every tool in place to stop this distribution that is flowing into illegal hands and to dark markets. The consequences of turning a blind eye to suspicious orders has to be over. We need the help and support and the tools that are in this legislation. So I know that we all believe in giving our law enforcement the tools, but that they also need help by making sure that these penalties are strong and that those suffering under this addiction are also given the treatment in this legislation. So as I said, I hope that our colleagues will soon pass this very quickly in the House, and we'd be happy to take questions. But before I do, if I could just say one other thing, I want to thank Attorney General Bob Ferguson for today's landmark victory as it relates to Hanford workers at Hanford. They're working with the Department of Energy, working with the workforce at Hanford, and representing our state. They have come up with a good 3-year term to help the safety of our Hanford workers in their efforts of Hanford cleanup, which is one of the most rigorous demands. So thank you, Attorney General, for doing that great work and helping our Hanford workforce.